am Dr. Fatima Cody Stanford, Chief Resident in Internal Medicine and Pediatrics at Palmetto Health, University of South Carolina School of Medicine. I'm delighted to be a part of the AMA's Physician Interview Project, and I'd love to share my story with you. Why did I decide to become a doctor, and when? I think that's a great question to ask. I really decided very early in life. At approximately the age of 3, I told my parents, my teachers, and all of my family members that I wanted to pursue a career in medicine. Of course, many children tell their parents that they're interested in pursuing the field of becoming a physician or doctor at that age, but not everyone is able to sustain that interest. It's a long and arduous road, but I felt relatively strongly committed to pursuing medicine as a career. My great aunt was a nurse in New York, and I remember talking to her as a young child, I think probably around the age of 4 or 5, about my interest to become a physician, and she thought I should consider a career in nursing. I told her I didn't want to be the nurse, I wanted to be the doctor. I felt as though the doctor was the one that the patient looked to readily for answers about their health and their family's health. That's something that I think has sustained me throughout my career as a resident physician as I go out and pursue a career being an internal medicine pediatric physician. I think that it's important as you go through both high school, college, any type of graduate courses, and medical school to be involved in different activities that will sustain your interest. I happened to attend Benjamin Elijah Mays High School in Atlanta, Georgia, which had an Academy of Math and Science and was focused on preparing persons that had an interest in pursuing healthcare professions. In fact, many of my classmates have also chosen to pursue medicine and are practicing physicians throughout the United States. I feel as though we had a strong support base with our counseling staff there to encourage us to continue to pursue our career paths. Each week we would get announcements that would let us know about programs that were geared towards persons wanting to pursue careers in academic medicine specifically. So most of us were heavily involved in research projects. I began to be involved in research in high school and pursued biochemistry research at that time at Emory University through funding from the National Institutes of Health, and continued that research into my college years. At that time, I became involved in the Howard Hughes Medical Institute at Emory University in Atlanta, Georgia, and continued research looking at tetracycline labeling in ancient Nubian femurs, something that continued to fuel my interest. Also in college, I was involved in the Phi Delta Epsilon medical fraternity, and I think being involved in organizations such as that helped to sustain my mission to pursue medicine as a passion. Before going to medical school, I did pursue my master's in public health and health policy and management at Emory University. While there, I became heavily involved in projects targeting issues surrounding socioeconomic disadvantaged populations, specifically ethnic minorities. I worked on issues surrounding obesity and healthy lifestyles with different programs, and I think working with these programs has ultimately led me to pursue my path in both internal medicine and pediatrics. One of the major barriers that specifically ethnic minorities face as they seek to pursue a career in medicine is financial disadvantages. Thankfully, I was the recipient of both a full scholarship for my undergraduate education and for my medical school education, and having those funds available were important in sustaining me throughout those levels of education. I did rely on some loans and additional outside scholarships to help fund my career, and I was very thankful to have a caring and supportive spouse that was able to support my efforts not only emotionally but also financially as I pursued a career in medicine. I'm very thankful to have the opportunity to serve patients in internal medicine and pediatrics. I feel as though what I have done, what I've accomplished, is not only a gift to myself, but really a gift to others. Thank you.